Welcome to Rook's Health. My name is Farouk Bello and I'm the host of the Rook's Health podcast as well as this YouTube channel. So today we're going to be going over 3 core tips along with some bonus tips at the end for interviews, particularly in healthcare, both NHS and private. So I am a physiotherapist by profession, but I've also had the opportunity of being on both the applicant side as well as the interviewer side. So hopefully these 3 tips can really help you ace your interview one time, especially when the stakes are high and you're trying to apply, get a job in the UK, be it as an international student, an immigrant, or a home student. So hopefully you enjoyed these videos. Let us begin. So the first one we're going to go over is a values-based system. So with these 3 tips, you want to align your values to your trust values. You want to know how they relate with each other. And also you want to be able to describe them from a personal experience. So give personal examples when you're giving a values-based system. You may or may not know that generally the NHS has gone through dime shifts of how they want to employ individuals and many things in between as well. But what you want to be very familiar with is what you call a values-based system. So each trust most of the time has their own values, visions, and things that they hold dear to them. Now, these can be very abstract concepts that are still very relatable with patients, such as kindness, compassion, trust, nurturing, safety. Now, these are very wide, so that is where it has to be very specific to wherever you're applying for. Now, a lot of the times in certain cases, you will be applying to a trust, and if you don't know their values and they hit you with a question during the interview about their values, you will be caught off guard. Or they might not even ask you directly. They might ask you a question that they want you to demonstrate your values and see how well it aligns to theirs. Now, let me give an example of this. Let's say your trust value is kindness, for example, okay? You want to be able to demonstrate to the interviews how you've actually shown kindness in your own practice. Now, a lot of people think that you only have to show from maybe if you have NHS experience, but if you haven't had an NHS experience, again, it does not really matter where. If you give an example from Nigeria, Malaysia, India, Mexico, wherever it is, as long as it's relatable, personal to yourself, how you've shown that example, as well as relevant to the question that is being asked. Now, a lot of the times you don't want to deviate on a tangent answering a different set of values or different set of trusts. You want to try and use those words that they align themselves with the trust and also show how they relate to yourself. Example is, again, kindness. You can give an example of a time maybe you were on the ward or you were seeing a patient and you went that extra mile. But in that interview, the only way they're going to give you the marks is if you can show that you have actually demonstrated these values. Number 2 is showing a patient-centered care approach in your answers. So what you want to show with this part is, 1, how does it relate to your role? 2, can you describe it? And 3, is it relevant to the role you're actually applying for? Now, when I say patient-centered care, you might be wondering what is patient-centered care or what does it mean? You might be called different things in different countries or different parts of the world, but it all means the same thing, that whatever your answers are or whatever you are describing to a patient or you're describing to the interviewer, you are showing that you are putting that patient first. So let's give an example of patient-centered care so it makes it more clear. You're on a ward and someone's had a fall, for example, and you go over them and you see how they're doing and you follow the standard protocol of, clinical protocols of what you do. Someone has a fall, you check, make sure they're awake, you make sure their obs are okay, you make sure everything's fine, you've alerted who needs to be alerted. Another step you can take it forward, which will also be in relating to, for example, if their kindness is the trust values, you can say something like, how you maybe went back to check up with the patient to see that they're okay. You made them comfortable. If the protocol at that time for what you're seeing is don't touch the patient, leave them on the floor. Did you offer them a glass of water? Did you try and help them out with a pillow? Maybe just showing that your kindness comes out as well as you're thinking of the patient. You can also be switching any other different setting, just making sure that you're showing whatever answer you're giving, be it the most clinical person, you are also showing that you are thinking of the patient. Because, and I'll tell you why, because you meet a lot of individuals, a lot of clinicians, people in biomedical sciences, physiotherapists, doctors, that are absolutely the smartest people you probably come across, but they're not very good with talking to patients and providing that communication. So you want to be able to show that you, alongside the clinical side of things, your stuff for your profession. You are a great nurse, but you're also a caring nurse at the same time, because those two things are not mutually exclusive. They come together and provide the best care. So that's how you can show patient-centered care. Again, you describe it personal to your experiences. That's always very helpful. And you're also allowed to show your flaws and where you realize, maybe you reflect and show that you are thinking about this constantly in your own practice. The third and final point is about the job specifications. Now, if you go on NHS Jobs or any site that you're using to apply for jobs, be it LinkedIn, Indeed, wherever you choose to, you want to make sure you read those person specifications as well as the associated documents with it very well and thoroughly. Now, this part is one that I think can get very, very overlooked. I'll give you a personal example. When I was applying for a Band 5 job straight out of university, I applied for over 20. I think I've said this in the previous video where I was applying. I'll be honest, at certain points in the initial phases, I wasn't reading all of the person specifications. I just saw a Band 5 job, physiotherapist, and I was sent off my application. Send it as many times as possible. And then it really caught me off guard in some areas because they would ask me specific questions that were intertwined within those person specifications about the role, and I couldn't answer. So after a while, I realized that's probably not the way, and I started doing the work because I knew it meant a lot for me to get this job. And if you're an international student or an immigrant, there's sometimes a time limit that you need to apply and get these jobs within. So you want to make sure that wherever job you're applying for, you read everything thoroughly, do the research, go onto the trust's websites, look at their values, look at the things that they're doing. If they're giving you a specific role, because and I use physiotherapy a lot because I'm a physiotherapist, but if you take nursing, for example, as well, not all nursing roles are the same. You have ICU nurses, you have community nurses, you have outpatient nurses. So you need to understand within your trust what they're doing with that outpatients department if you're applying for that department, or community. You need to know what they're happening in that specific trust, because what happens in the community in my area is not happening in that other area. So when you're applying for this job, they might put specific things in that person's specifications that might catch you off. Now, look, honestly, you might go through the whole interview and they don't ask you anything. But if they do, then you're caught off guard. So make sure you go through it in depthly, do the research. And I always say, as a rule of thumb, whatever place you're applying for, go on the trust website and just go through everything and see what's there that might be relevant to your role. Adding all these things extra, it's not going to do any harm. It's only going to give you a bit of a bonus as well if you're able to demonstrate that you've actually put the work in and this job means a lot to you. So welcome to the bonus section of the tips I'll give. So the three bonus tips I wanted to give particularly, I think is often overlooked, especially if you are new to interviews or you don't like interviews particularly. There are some people I know who are very good at interviews, and there's some I know who are still great clinicians and still very caring to patients, but they don't like that whole, someone's watching me and asking me questions. They get really nervous at that time. So one thing I'll say is you can pause, okay? People often think it's not good to pause, or as soon as you get answered a question, you answer it right back immediately. Now that's fine if you know the answer to the question and you can answer that question very well, but it's okay to pause for a moment, think of the question that was asked to you, and then reply. Okay, it's all right to pause as long as that pause isn't like a 2-3 minute pause that shows you actually don't know the answer to the question. But as long as you can pause for a moment, think about it again. Also, second point is ask for the question to be repeated. You can ask for it repeated 2-3 times. If you're doing it over Zoom, you can just say you didn't hear it very well. It's completely understandable. Repeat the question, think about it for a moment, and then regurgitate the answer back to them, because you do not want to seem as though you are overeager and nervous and then not being able to give clear, lucid answers. Because when people start getting panicky, you're not going to be thinking as straight as you would normally. And then the final thing that I wanted to add is prepare yourself for 2-part questions, 3-part questions. What this means is basically it is one question that you'll be asked. Sometimes it happens, some places don't use it, but it's broken into 2 segments because it's relating to an overarching topic. I would say if you can answer them separately, meaning but they're relatable, use maybe a relatable experience, or you're answering them. But sometimes what often happens is you'll answer one part of the question but forget the other, and you think you've given a very good answer for only one part, and you may not be able to score on the other part of the question. So make sure you just answer both questions. That's where those first 2 tips come in place. Again, you're asking, you're repeating. Okay. And the final piece of advice I'd give is that it's very normal to get rejected from interviews. It's not the end of the world. Some places are very competitive in UK. Some places are not so competitive. You know, it's variable, and I've gone through this in previous videos, so I won't go over it again. But you will get rejected sometimes. Sometimes you might apply your first job, bang, that's it. But don't get discouraged. That's the moral of the story, basically, is not to get discouraged and keep on applying and keep on going. And because every time you miss one interview or you don't know one thing, ask for feedback. They give you the feedback and then you take it to the next one, so you're only getting better after each interview. It's very corny advice. It's very, very basic. It's very, what everyone tells you, but really and truly it helped me get through, hearing back bad news or hearing back conditions about, oh, we don't sponsor visas, or we don't do this, or we don't do that, or we'll get back to you and no one gets back to you because of things that are beyond my own control. Or I might interview well, but I'm still hearing back that we don't sponsor visa, or we're not sure, or we don't have enough. So I don't get demoralized, and I don't hope you get demoralized as well. Take care of yourself, and stay tuned for the next video.